The problem our group will be covering is drug addiction. More specifically, we will be talking about heroin. Drug addiction is a destructive pattern of drug abuse that affects a person's brain and behavior while leading to problems involving tolerance and withdrawal. Substance misuse is a serious public health challenge. Whether through overindulgence in alcohol, misuse of prescription medication, or use of illegal drugs, such misuse is harmful to our health. Drug use and misuse continue to create public health challenges in the United States, leading to overdose deaths, HIV and hepatitis C infections, and other chronic health conditions. Drug addiction can cause serious long-term consequences, including problems with mental and physical health, relationships, and the law. The use of heroin is a health behavior as it is an example of substance use. Heroin is a depressant of the central nervous system as it slows down brain function and particularly the control of breathing. Heroin can lead to addiction, which is a form of substance use disorder and has led to many overdose deaths.
Who does heroin addiction affect? In 2020, in the United States, about 0.2% of people ages 12 and over reported having a heroin abuse disorder, and that year as well, there were 13,165 reported deaths associated with heroin overdose, and almost 20% of opioid deaths are heroin-related. Heroin overdose rates are found to be more common in white non-Hispanics when compared to black non-Hispanics and Hispanics from 1999 to 2017, and the overdose rates have climbed significantly in all populations over the years, as shown in both figures. As seen in the figure on the right, heroin use is again more common in white males, people with low incomes, those ages 18 to 25, and people lacking health insurance. Factors related to heroin abuse include about 45% of those who abuse heroin having an addiction to prescription opioids. Other risk factors include people having a genetic predisposition to addiction, environmental factors such as chaotic home life and parental and peer drug use, and having poor mental health such as anxiety or depression.
So what has been done about the heroin epidemic? So heroin is highly illegal federally, making it more difficult to get access to. There are addiction treatment centers, however, most require insurance. There are clean needle programs, which replace people's used needles for clean needles to prevent infection of people through multiple people using the same needle. Some of those programs are governmental, but most are quasi-governmental or have private funding. Not enough has been done overall. In 2020, there were 1,300 heroin OD deaths, which is trending down from 2016, but it's still far, far too high. More needs to be done to combat this epidemic.
Hello, I am Adriana, and I will be talking about the misconceptions of addiction and how health workers can help/influence. Two main misconceptions about addiction is that relapse is equivalent to failure and that one can quit whenever they want. And with that information, public health professionals can help prioritizing the lifestyle effects of these substances and calculating the amount that they are prescribing to other people. Another important factor is the resources. There are countless of resources for recovering addicts and people who are seeking. There are rehabilitation centers, therapy, online therapy, and people just in life who influences that. But what many people fail to understand is that an individual who is suffering with addictions makes the choice. It cannot be implemented or induced to permanently have the effect of them wanting to change. It's their decision and how prominent they are with that decision.